gentlemen, to the season 2 of Dr. Tapeswini's Corner. That's me, and I work as a head and neck cancer surgeon. Today's discussion is focused on a very important public health issue, and that's obesity. Worldwide, obesity has nearly tripled in the last 50 years. It has risen dramatically, especially in the developing nations where malnutrition is quite common. After the US, China, India ranks third in its incidence. Let's throw some light on this issue through our expert today, Dr.Parveen Bhatia. You're the founding chairman and senior consultant at the Institute of Minimal Access, Metabolic and Bariatric Surgery at the Safar Gangaram Hospital. You also hold the position of medical director, Bhatia Global Hospital and Endosurgery Institute. Your surgical expertise in laparoscopic, robotic, and bariatric surgery, and also your flair for teaching has been recognized with several awards and accolades. Welcome, Dr. Bhatia, to the program. It's indeed a pleasure to have you on the show today.
Thank you, Dr. Tapeswini, for a nice, small, crisp introduction and focusing on my favorite topic of obesity. I know you have been talking about malignancy a lot, and creating awareness of obesity is also a big task, and I am very, very privileged to be part of this program for the audience world over. Thank you, Tapaswini.
Welcome, sir, once again. So let's start the program with a beautiful quote, and it says, "Your diet is your bank account. Good food choices are a great investment." But then in this crazy world, we're always on the run, trying to meet all our deadlines. So meals are whatever is convenient and fast. So Dr. Bhatia, do you think this lifestyle is a matter of body? And how exactly do we define this?
Sure, I would say that especially in the today's era, when the race is too fast, one has to, obviously one cannot defy the competitive era. So one has to modify the lifestyle in such a way that ultimately we are investing in health. I use a small phrase that people start investing in cars and houses and whatnot, but our thoughts are invest in health. And for the investing in health, one has to strike a work-life balance. And that would mean we are not at all saying that don't work hard, work smart. We always say that please keep maybe 45 minutes for yourself for exercise, 45 minutes for yourself to go inside you, and then start thinking you are what you eat. You are what you eat. So if you are eating protein diet or if you are eating junk food, that will make you.
Fully agree with you, sir. But tell me, we use words like overweight, obesity, morbid obesity. But what would a common man infer out of it?
Yes, good question. I would say that WHO has also defined the obesity, overweight, morbid obesity. Basic thoughts are that this is measured by BMI, body mass index. Normally, the body mass index for a healthy individual is 25, whether it is male or whether it is female. But if the BMI is exceeding 30, then it becomes overweight. And if it is exceeding 35, then it becomes morbid obesity. Only thing is that one can have the comorbidities associated. For example, if especially our Asian population is having diabetes, hypertension, thyroid, or so many challenges associated with it. So the WHO also advocates that you reduce 2.5 units of BMI, and that should be counted as the indication for obesity, morbid obesity, overweight demarcation.
But do you, through your practice, feel that obesity has now become a public health issue?
I would just say the same sentence which the WHO has used: the obesity is a disease. Obesity was never ever counted as a disease. People used to flaunt the lifestyle. People used to think that I am opulent, that is why I am having that weight. Right from the childhood, I belong to an excellent family, that is why I have the weight. But no, it should go into the minds of people that even WHO has labeled it, and it became very late, that it is a disease. So one should identify it is a public health problem, but it is more of a disease. It should be treated as a cancer.
Okay. So you've been alluding to BMI. So what does it actually mean?
I would say that you cannot manage what you cannot measure.
Correct.
You cannot manage what you cannot measure. Basic thoughts are: how much money do you have? You have to measure. So, how much health you have, it has to be measurable. So, if for example BMI, it is basically one has to take the weight and the height in meter square. So, basic thoughts are that if for kilogram per meter square, the basic formula for BMI is kilogram per meter square. So one has to know the weight, one has to know the height in meters and square it. So that comes out to be the BMI formula. So basic thing is that if for example my BMI is 25, I should be very happy and I should be able to maintain that. But if it is going beyond 35 because of my height, because of my weight, then I should be concerned. And I should know that if I am going beyond 35, I have to be absolutely focused. Focus on more focus. I should be focused on improving my health so that I am having good amount of exercise, I am taking care of the dietary factors, and I am not letting my denominator, or because you cannot change the height, you can only change the weight. So just take care of your weight, and then your BMI will be controlled, and in turn you will be controlling all the comorbid conditions which are associated with obesity.
Right. But then other than BMI, if I ask a common man to measure whether he's obese, are there any other indices?
Yeah.
Weight size or something?
Sure. Basically, all of us know our waist size, right?
Right.
And all of us know our heights also. And basically, in especially once you are in this jargon, there is no fixed formula that yes, this will tell you the exact health. No. Even BMI has been questioned, even waist hip ratio has been questioned, even the two arms. I would label this as just extend these two arms like this and measure the distance, and if that is the equivalent of your height. So basic thoughts are that ultimately the weight by height in meter square is one of the parameters, but there are many parameters, especially in children also, whether they take the arm circumference, waist circumference, hip circumference. So many factors are there, but again I would say there is no hard and fast rule.
Right, okay. But increasingly, obesity has become apparent in children. So, what could be the probable reasons?
I would divide this into prenatal and then after delivery, the children after delivery. If, for example, there are young girls, nowadays all of us have seen young girls having lot of weight, and they believe on junk food. They start taking junk food, they take more of carbs, less of proteins, and more of fat. So if they are taking, then the basic aftermath of increase in weight, especially in young females, is that they tend to increase weight. They have polycystic ovarian disease, and once they get married, then the chances of infertility are very high. So we always say, shed before you wed. Shed before you wed. So once the heavyweight mother is there, for example, even infertility was not there, and if the mother was heavyweight or morbid obese or obese, then the chances are that the delivery, the fetus or the baby will also be overweight, bigger size than normal. And then once the always said that obesity runs in families because nobody runs in the families. So nobody runs in the families. So once the child is born, once you start feeding carbs, less of protein, more of fat, and you take pride that yes, we are taking, and we have a chubby boy, chubby girl, then the obesity will carry on, and this obesity is going to be dangerous. In the sense, because these children, we have seen even at the age of 1.5, 2 years that they have such a weight that it is beyond imagination also. So obesity sets in there, and then one carries on having childhood which is obese, and when the exercise is less, they don't play, but they are eating and overeating, then the obesity becomes, and then they have different problems later on. So our thinking is both the components have to be taken care of by the mothers, that yes, the diet and the exercise.
Correct. But do we measure obesity in children with the same parameter as in adults?
No, as I told you that there are many anthropometric measurements in which, for example, we would always measure the arm circumference. In children also we would measure the height, weight, and also BMI, also waist hip ratio also. So what I mean to say that there are n number of parameters which can tell us that the growth, we always chart the growth, as all of us we have seen in our childhood also, that the graph has to be maintained, and if the graph is going beyond some percentile, then definitely the child is heading for obesity.
Okay. But are there periods in the early life of a child, of a growing child, which are important predictors of his obesity later on?
Sure. For example, as I mentioned, that pubertal age.
Right.
Pubertal age, most of the people, most of the children, if they start gaining weight, if they are not conscious, and the hormones are also tuned to that aspect, then they will start gaining weight. Can you imagine once the child or once the person of 40 years or 35 years comes to us, and I always ask that for how long the obesity has been there? Since childhood. Since childhood. So they always maintain that. So our thinking is that right nip in the bud. So basically we have to make sure as soon as we are going off the percentile, then one should become conscious and then start reducing the weight right there itself, rather than repenting later on.
Absolutely. But do you feel that industrialization and commercialization has impacted the scenario?
Oh yes, 100%. I would say that first is that babies or the children are not playing at all as we used to play in our childhood. Never ever I will come back from the school without playing football or basketball or hockey or whatsoever. But today they don't play. One, they play, yes, games. I always ask them, what games do you play? They say they play computer games. And that is the only thing which they play. And basic thoughts are that yes, one has to exercise and one has to change the format. I always say, धुन बदल के देखो. धुन बदल के देखो. If you are spending energy, if you are exercising, and if you are making sure that all the intake which you are doing, or the parents are also making sure, then definitely the weight balance will be maintained. Because of the industrialization, because of the commercialization, because of the TV media, because of social media, now so much of carbs are being sold, and children also are addicted to whatsoever things are available, and then it is very, very difficult to take it off. So I would say that it is the responsibility of the society also to make sure that we should not just carry on selling the uncle chips or chips, potato chips. What I mean to say, we should always try that. For example, in New York, they have been able to control obesity to some extent once they started making the availability of Coke also at a higher price, the chips also at a higher price, but still they have not been able to control. So our thinking is that the public administration departments, they have to control also, that make it so inconvenient for the child to have the excess of these kind of foods, so that ultimately, yes, the children are trained well right in the school.
So how true, Dr. Bhatia, is it that if you have childhood obesity, it would translate into obesity even in the adulthood?
Yeah, I would say that 70 to 75% chances are that the child will grow on and become an adult obese also. Very, very, I would say motivation, lack of motivation is there. Very few, 25% of the people have that kind of motivation at the, I would say, post-pubertal age, when they have some maybe cross-sex introductions. Then they start reducing weight, going to gym, exercising, and then definitely they are able to reduce it. But most of the children, if they have started gaining weight, they will carry on gaining weight until unless they find somebody who points out to them, yes, now it should be reduced, and then they are able to maintain that.
Okay. But then is this obesity in the childhood different from what you would experience in the adulthood?
Yeah, definitely. As I mentioned, the earlier the obesity sets in, the earlier the comorbid conditions will set in. So basic thoughts are that ultimately, as you know, that as I mentioned also, that polycystic ovarian disease, especially in females, that would develop because of the obesity. If I start treating the polycystic ovarian disease only for and treating the infertility, I am fooling myself and the patient. I have to treat the cause of PCOD, that is a hormonal imbalance because of the obesity. So first target should be treat the obesity, then polycystic ovarian disease will be treated itself, and then infertility will be treated itself. So our thinking is that the difference between childhood obesity and adult obesity will be only the association of comorbid conditions.
Right. So this morbidity and mortality, we've known as medical professionals since the time of Hippocrates, which is more than 2005 years ago. So then what are the long and the short-term impacts?
For example, as I mentioned in the talk also, these obese people become or are more prone to have the diabetes, hypertension, sleep apnea syndrome, arthritis, backaches, even they develop the cardiac disease. Even they are having more propensity to develop the cancer also. For example, endometrial cancer, even the breast cancer. It has been reported that those people who are obese, they have a more tendency to develop the cancers also. So our thinking is that please don't be shy away, never ever shy away. One should be conscious enough to control the weight. We cannot control the height, and then control all the comorbid conditions.
So which are the cancers you just alluded to?
Endometrial cancer, for example, uterine cancer, it has been known, even breast cancer has been known that the incidence of these two or many other cancers also increase by when the person is morbidly obese for a long time.
Even the colorectal,
Exactly.
system, right? Because of our diet, there are a lot of issues pertaining to the GIT system and their predisposition to cancers.
Sure.
So then how true is that obesity increases the premature risk of death?
Oh, yes, it has been seen by world over studies that those patients who were morbid obesity, who had morbid obesity, they have a decrease in the lifespan by 13 years. They have done these studies, and in which they have seen those, they have taken the sample size in such a way that those people from the same locality, same people, but there were people who were obese and there were people who were non-obese, and they carried on studying them for a good number of years, and ultimately they realized that obese patients, especially morbid obese patients, they start having comorbidities and the complications of comorbidities earlier, and that is the reason of their premature death. And they have seen it ranges from 7 years to 13 years, that the lifespan decreases by 7 to 13 years. And in this COVID era also, personally, we have seen the 74% of the total deaths all over the world, when it was calculated, it was seen 74% were obese, and add on 13% were diabetic, add on 13% were hypertensive. So what I mean to say, ultimately obesity is the precursor of so many challenges.
Correct, correct. But Dr. Bhatia, many a times, you could be doing everything right, eating a good, healthy diet, but not even losing a pound of your weight. So, is there a way of, or is there a protocol for a healthy weight loss?
I would say it is all mindset. You have to dhun badalna hai. You have to change your perspective. Many times we start thinking that it is a good lifestyle. I am taking this much only. In Punjabis, you always know that always say that we take only two rotis and two pieces of breads. But our thinking is that, please, right from the beginning, and especially from this kind of forum, we have to tell them that please change your mindset. चीनी, चिकनाई, चावल, चपाती, चारपाई से दूर रहो. What I mean to what I mean to say, that please stay away from carbs. I am not saying make it zero. Make more of protein, very, very zero or less of fats, then only one will be able to reduce weight. Many times people say that I take only two chapatis and I am not able to reduce weight. No, shun the roti, shun chawal, shun carbs, so that ultimately, and take more of proteins. I would say that take egg white, take chicken, but not fried one, take mutton or roasted fish also, or take lot of pulses, take milk, skim milk. But ultimately answer is that change your mindset, that any time and every time I am going to eat anything, I should take more of protein first. Protein gives a good satiety. So as soon as I take protein, as soon as the satiety is there, I will not need even the carbs. So basic thoughts are: resist the temptation. Resist the temptation. Many times, most of the people are not able to resist the temptation, and that is the aftermath, that they start taking lot of fat, lot of carbs, and then they tend to increase, and it becomes a vicious circle.
Yeah, but then when you experience the feeling, when you lose that weight, you feel so light.
Absolutely.
Light as a feather, and your energy levels are so restored, well restored, and you feel so steady.
In the lighter vein, Tapaswini, I would say that when my young, especially females, come, and when we have done the bariatric surgery on them, and maybe after years and years they come and they still maintain the weight, so I always ask them, "Oh, good, excellent, you have been able to do it, and you have been motivated so much. So what do you eat?" And they say, "We eat compliments."
Wonderful.
We eat compliments. So definitely you are right. Once you start losing weight, you get so many compliments, and then you are having a motivation to keep on reducing weight.
Correct. Lovely. So, eating to feel good. Many people eat to feel good, and that's been a very primal human instinct. And then when we are stressed out, we crave for food which is rich in sugar, rich in fat. So, are there any low energy density diets that you would recommend for the people who are listening to us? And otherwise,
In one sentence, I would say that sugar is the ultimate killer. Sugar is the ultimate killer. Many times, as you have rightly put, many, especially young females, they have an urge. They have a strong urge to take chocolates. They have, they feel that until and unless I don't get the chocolate, my day will not pass off. So our thinking is one has to change the mindset. One. Second thing is that yes, please do not think of the on the sugar itself or on the sugar products or on the carbohydrates, on the cakes, on the chocolates. It should be written as is done in cigarette packs. It should be written as poison. Our feeling is that once you are taking a bite of cake, then one should always think that I am taking poison today. And once I start thinking that way, that am I taking a poison? Am I taking carbs? Then definitely that is going to change. So basically, thoughts are please do not depend on carbs, depend on proteins. And in protein, especially in as you have asked about low energy foods, so especially in vegetarian people, I would always urge that take a lot of cheese or take the beans or you take the pulses so or sprouts, so that ultimately they are giving a fulfill effect also, and they are not increasing your thoughts, and then ultimately the appetite is also full and one feels happy about it.
So one of the biggest needle mover is the sugar.
Yeah.
Yeah, and it's mind blowing to see the amount of sugar which sneaks into our diet every day. We may not realize it also.
So sugar is the ultimate killer should be written on all the walls. So that we once we go to the
Junk foods.
yeah, exactly.
Youngsters, they all run after food which they love it so much, but they probably don't understand that these are junk. So what does it mean, junk food to the body?
That's what I'm saying. Sugar is the ultimate killer because all said and done, sugar metabolism is absolutely different and it is getting converted into fat. Similarly, many times, many patients, when they come to us, I always tell them, what is alcohol? Alcohol is a sugar. So why are you carry on taking so much of alcohol? It is obviously this is the cause of increase in your weight. So our thinking is that please do not go in for junk food. Please do not go in for more of alcohol. Please take care of the carbs and switch over to more of proteins. And the once you start switching over, your mindset also switches over to protein intake. You will be definitely better off.
Right. But then we talked about sugars, but then you have artificial sweeteners, which
No
a lot of
use.
people think can buy, your sweet taste.
No
Does it
use.
impact our health?
No, I would say that it has not been proven beyond doubt that they are better. No, they are more or less similar kind of culprits. So one should try not to dodge the brain.
Right. But do you think the ads that are being played in the media are influencing our dietary patterns?
Yes, I would say that in today's era, because of social media, because of the ads, because so much of influence is there of the celebrities. For example, if they start selling the high carbs diets, then one starts thinking that if they are selling, if they are telling, if that must be good. But our thinking is that now it is the era of information. So much of information is coming, so one has to filter, one has to make sure that how in what to what information are you responding or reacting, and what information you are not able to or not ready to accept. So our thinking is in the children's mind, we should make sure that please do not believe everything which is being told to you. If you want to check it, it is good. Calories, you should check. How much calories are you taking? How much carbs you are taking? How much proteins are you taking? And then decide. I am not saying that you will not never do a cheat meal. You can do a cheat meal, but most of the times you should start maintaining that you have seen every calorie, every protein, every carbs which are going into your body.
Some people would not obey our instructions pertaining to food, they would love to go to the pharmacist and ask for some over-the-counter medications. So what are they and how effective are they?
I would put it this way in a broad perspective that so many drugs had come, so many drugs have side effects, and side effects to the extent of even causing suicides, and especially in young people also. So basic thoughts are, yes, the till date the drug has not come which can reduce the weight. The injectable drug has not come, or the pill has not come, which will ultimately be able to control the weight. There are, I would say, people or corporate who are pushing that this drug is better than the previous one. Previous one had some side effects, but now we have taken care of those side effects, and now their new side effects come. So our thinking is, please, if you are able to walk on your own feet, why use crutches? Why use crutches? Only thing is that you have to resist the temptation. You have to use your brain. You have to modify your lifestyle, and you will be able to. So please, for younger, especially for younger audience, I would say, do not go in for drugs. Do not think even that any drug is going to reduce the weight. We have all seen that people start taking on OTC medicines, and then later on they ultimately repent because so much of depression has come, so much of all other challenges, other side effects have come. So I would never ever advocate even a single drug. I know that I'm talking about some controversial aspect also, but still I would put it this way, that please do not go in for semaglutide or an XYZ medicines, which are having which are proven. And even if, for example, even if you are taking some medication, then the weight loss is not more than 4 to 5%. Your target is not 4 to 5%. Your aim, if we do the bariatric surgery, for example, then our aim is of the order of 70% of the excess weight loss. So our thinking is that 4 to 5% of the excess weight you can always lose by exercising and exhibiting the control over diet. That's it. So why not change the mindset? Why not have that thoughts and then not be dependent on the drugs?
So we should insist more on physical activity.
Absolutely, absolutely.
Dietary intervention.
For this I always say, सर जाए पर सैर ना जाए, सर चला जाए पर सैर ना जाए, and हरकत में बरकत है, हरकत में बरकत है. If this message goes on to our children, that you have, right from maybe 4th class or 5th class, I had learnt this, that सर चला जाए पर सैर ना जाए और हरकत में बरकत है. That has kept me going and still going. I do weightlifting every day for 1 hour in the morning and 40 minutes walk, even if I am so busy running in between two hospitals, but still I invest in my health.
That's wonderful, wonderful. So you talked about surgery for obesity.
Yeah.
Can you just give us a little more detail on it?
Sure. The basic thoughts are that if you are able to control your weight, nothing like it. Nature is the best provider. So if your body mass index is ranging between 30 to 35, I would say that still exert more, go to gyms, do the exercise, resist the temptation, try to reduce your weight, nothing like it. But or to the nutritionist, nothing like it. But if your weight has gone beyond 35 or 32.5 with comorbidities, then this role of surgery starts coming. There are patients who are having severe diabetes, severe hypertension. They are not able to sleep at night because of obstructive sleep apnea. They are having so much of reflux of the acid also during the nights, and they are not able to sleep. They have to sleep like this, sitting position. So if the morbid obesity is there, then we always advocate surgeries. And surgery is primarily divided into malabsorptive or restrictive surgery. I am not going into the details of it, but I would say that one is the sleeve gastrectomy and one is the bypass. Whether you do the sleeve gastrectomy by laparoscopic method or by robotic method, similarly bypass also, laparoscopic or bypass, or robotic, or there is something in between that is called as mini gastric bypass. So ultimately answer is that if your stomach has expanded, and you are just making sure that you are cutting and stapling the stomach and making it approximately 100 ml only. Previously, it had gone to 1.5 liters of stomach. So, if the stomach has gone this big, or it has become or expanded in so many years, so it is better to cut it to 100 ml of sleeve is left behind, and rest every intestines are not handled. That is a sleeve gastrectomy, and that is the commonest procedure world over today. Sleeve gastrectomy in US and everywhere, it is the commonest procedure which is taking care of the obesity. But for example, if you are having diabetes, if the diabetes is uncontrolled even with lots of insulin, if for example you are having on endoscopy, one finds that there is a hiatus hernia or lot of reflux is there, then definitely we advocate that we should go in for gastric bypass. Bypass would mean the food is not going into the stomach, it will be bypassed. It will be going from esophagus to small pouch of stomach and directly into the intestine. So it will be adding on to the malabsorption, and that way the diabetes will also be controlled, the weight will also be controlled, and all other comorbidities will be controlled. But again, a rider is, I always tell my patients that once we are going for surgery, once we have decided for surgery, please do not think that it is a Ramban. You have to be with us, and I have to be with you, in the sense that if you start thinking that I have got the surgery done, now I am not going to exercise, now I am not going to resist the temptation, now I am going to take as much of carbs as possible, now I am going to carry on taking fat diet and junk food, no, you will not have the desired result of 70% excess weight loss. So you may gain after maybe 2 or 5 or 7 years the original weight you started with. So our thinking is, please think that it is just a tool, that we are giving you a tool to just reduce your weight and then maintain it for ages. And once you go in under the knife, then you follow a strict protocol of liquid diet in 3 weeks and then semi-solid and solid diet. No alcohol or no tobacco, no carbs, less of carbs, more proteins, and so on and so forth.
Painful exercise.
Yeah, and exercise. Exercise, one has to carry on doing the exercises to increase the muscle mass. That is very important.
Yeah, so prevention here, again, prevention is better than cure.
Sure.
So childhood obesity and adult obesity, is there a difference in the treatment also?
Yeah, as I presented, that we always make sure that if they develop childhood obesity, then we wait for the skeletal maturity. Means that the bones, the epiphyses have fused, and because all said and done, human is human, nature is nature. If we take off the stomach, then some hormones will definitely be altered. Ghrelin hormone and so many hormones will be altered, and that will ultimately affect the maturity of the child also. So in children, I would still wait till the age of 18 years or more to ask or go in for surgery rather than hurrying it up. Our thinking is that we should not lead on to deficiencies of calcium and iron and so many products, and then ultimately the child is not able to maintain its skeletal maturity. So the childhood obesity is different, but in those children, for example, who have gone beyond 18 years, who have X-rays also show that their epiphyses have fused, their skeletal maturity has been reached, then we offer them sleeve gastrectomy rather than gastric bypass. But as the children grow up age, then as I mentioned, that the dividing line between sleeve gastrectomy and gastric bypass is the diabetes or other comorbidities or hiatus hernia or reflux, then we go in for bypass. I would not go in for bypass in every case. I would not go for sleeve in every case. So one trouser would not fit all. So one has to individualize the treatment.
Absolutely. So what I understand that there is a holistic approach to the treatment of obesity. You have to look into the behavioral, you also have to look at the environmental and also the pharmacological issues with obesity. Thank you so much.
Just a
Dr.
sec,
Bhatia.
just a sec. Tapaswini, we always say that you don't have to, we have to see the whole of the patient and not the whole of the patient. What I mean to say that take the patient in totality, as you have rightly mentioned, take the potential patient in a totality. Don't treat only the stomach. If you are treating only the stomach, you will never be able to find the good results. So if you are taking care, as you have rightly pointed out, that the patient should have a consult with the psychologist for behavioral therapy, this patient should have the consult with the endocrinologist and all other physicians. It should be a good teamwork. Then only you are able to give the best to the patient, best results to the patient.
Thank you so much, Dr. Bhatia, for such lovely inputs with respect to obesity. But before I part, we can surmise the whole thing, and it is you don't have to eat less, you just have to eat right. And nature is smart and it puts medicine into your food. So remember, listeners and my viewers, eat food as your medicine and not medicine as your food. So if you don't find time for your health now, sooner or later, you'll have to find time for your ailments. So friends, flip the coin and move towards a healthy lifestyle. Thank you so much to all the listeners. Thank you, Dr. Bhatia.
Thank you.
See you
Invest
again.
in health. Invest in health.